What's up, everybody? It's Steve the Hurricane here, and with today's episode of A Drink with the Hurricane, I want to remind you and urge you to right now make sure you are registered for the virtual boot camp Embracing Change from Pandemic to Profitability this September 17th and 18th. All new content on how you can scale and grow your home care business during the COVID-19 pandemic. Drink with the Hurricane, the home care sales and marketing talk show that discusses all things growing your home care business. This is good downtime right now, like while all the pandemonium and everything's happening outside the walls right now, and all the fear and anxiety, and everyone's kind of quarantining and social distancing themselves. We're not allowed to go into accounts. Building our foundation, getting the training and the knowledge, and then planning it out. As soon as these bans lift, go running at it, because I know it's going to take me 2 to 3 months to start getting referrals from that day as I go forward. You can do some LinkedIn stuff tomorrow. Megan is going to give a presentation on marketing during a lockdown. So that'll give you some COVID-19 action plans that you can immediately implement. But when it comes to developing accounts, that's the kind of time it's going to take when you go into these accounts. So let's jump into it. First thing you have to do in understanding developing a referral source is you have to qualify these accounts. If you don't qualify these accounts, you could easily waste months, maybe even years trying to get business, because every account is not created equal. And the first part of it is the magic number. And I talked a little bit about this yesterday with those face-to-face visits. You should see one person for every hour that you spend marketing. So if you spend 20 hours marketing every week, you should see 15 to 25 people face to face. If you are full-time and you go 40 hours a week, you should see 35 to 45 people face to face. I already talked about that yesterday, so I'll move on. The best referral source for everybody, every person on here, home health, hospice, private duty, are your hospitals. They are your best referral source for the simple fact that they have the volume of patients. So when you think about your average hospitals, I just said to you before, discharges around 200 patients a month. So when you think about how many of those patients are Medicare beneficiaries, how many of those patients have 5 or more chronic conditions, so home health and hospice, Medicare beneficiaries, that's 60% of their discharges. 200 people going home, that's 120 potential clients for home health. Hospice is obviously the people who have the greatest need in their end of life. So it's not 120 out of that 200. It's probably more like 20 out of that 200, about 10%. But still, 20 potential referrals in 1 month for a hospice from one account. Yeah, that's fantastic. And then from the private duty standpoint, you're looking at people with 5 or more chronic conditions. So from that 120 Medicare beneficiaries, 20% of those have 5 or more chronic conditions. That's going to be about 25 people every single month coming out of a hospital that are going to need help beyond what Medicare covers, and that's you, the private duty folks. So for every one of us, the potential from a hospital is ridiculous. Now, you heard me say they are the hardest account to develop, and that's the truth. The other thing about hospitals that I will tell every single one of you is that you want to have like a little bit of word of caution when it comes to hospitals. If your business isn't able to take same day discharges, and think about what I just said, right? Home health, 120 possible discharges a month could go to you. So, every single week you're talking about picking up 20, 25 referrals potentially from a hospital. If you're not able to do same day discharges and screen and do what you have to do for it, don't go into the hospitals, because you're biting off more than you can chew, right? From the private duty and the hospice side, when you get a phone call, somebody's going on hospice, somebody needs private duty help, you got to have a 1-hour turnaround time, and you got to be able to get out there and see that person, sign them up, and start them later on tonight. If you're not able to do that, and what I just told you, 20, 25 patients a month are going to need your services from the hospital. If you're not able to handle that 20, 25 times a month, same day, then don't start going into hospitals yet, because you're going to do a lot of work to get in there. They're going to start referring you. You're going to mess it up. You're going to burn the bridge. and then they're not going to refer you again. And it is 10 times harder to get back into an account where you messed up and had service failures than it is to go in without any type of a reputation yet.